Automatic registration for laparoscopic surgery. The concept of automatic registration. The surgical tool's tracking limitation is solved, and human interaction is not required. The most important criteria for automatic registration is to recognize the location of the targeted organ in real time. There are 4 selected research papers about automatic registration. First is automatic registration of Da Vinci system to the image of transrectal ultrasound. This system is used for urology surgery, and the manual benchmark for localization is substituted by automatic localization method. The registration error between the Da Vinci frame and truss frame are investigated for each test case, followed by evaluating the localization accuracy. Second is our application with physics-based elastic registration. This application can adapt to topological changes detected in the intraoperative model automatically. Besides, the virtual model with internal structures can be kept coherent with the deformation of real organ after an incision. Third is continuous volumetric computed tomography for LiVAR in laparoscopic surgery. Automatic registration was used to map the preliminary and the intraoperative CT scans. Also, the accuracy of the registration was inspected quantitatively and qualitatively. LiVAR is better than conventional R, in terms of reduction of the misregistration problem. Fourth is projective biomechanical soft tissue with fully automatic featureless non-rigid registration method. The main contribution in this method is dynamical adjustment of preoperative model to the current surgical laparoscopic scene. The registration procedures do not require tracking process, as the procedures utilize dense depth matching. The findings after reviewing the 8 proposed system or method. Interactive registration is limited to rigid registration. It cannot adapt to organ deformation. Rigid image will become untrue if the surgical anatomy of the patient changed by surgical tools. Registration is performed manually using the software application for deformation of 3D software architecture. Automatic registration reduces the complexity of registration. It deals with real-time and non-rigid registration. It can decrease the misregistration in conventional augmented reality. It is able to handle dynamic organ deformation. Conclusions. The findings imply that automatic registration is a more time-effective approach, and it can handle the organ deformation with minimum registration error gained. Automatic registration has been recognized as the most effective registration approach to increase the R registration accuracy in laparoscopic surgery at the current stage.
Created using Powtoon.